Coronavirus is a deadly disease, but when it came from diabetics patients it became more dangerous. In this video we are going to tell you how diabetes patients prepare for coronavirus and our best product for diabetic patient during this pandemic situation. Everyone needs to be careful to avoid the coronavirus that causes COVID-19. If you have type 1 or type 2 diabetes, you should be even more cautious. Your risk of catching the virus isn't higher than anyone else's, but you could have worse complications if you do get sick. That's especially true if your diabetes isn't well controlled. Diabetes can increase risk of contraction of COVID-19. When it comes to infections, both diabetes type 1 and 2 can increase your risk of contraction. According to current diabetes review, type 2 diabetes can increase the incidence of infectious diseases and related comorbidities, although more research is needed. Diabetes type 1 also increases risks for morbidity and mortality, according to other studies. Diabetics have higher rates of complication and death from COVID-19. When it comes to COVID-19, the American Diabetes Association explains, in China, where most cases have occurred so far, people with diabetes had much higher rates of serious complications and death than people without diabetes. But why might COVID-19 and other viruses be so risky for diabetics? Let's dive in. Dysfunction of the immune response makes diabetics more susceptible to infections. For one, it's thought that hyperglycemia, which occurs when you have high levels of sugar or glucose in the blood in diabetics, may be a cause of dysfunction of the immune response, which results in failure to control the spread of invading pathogens in diabetic subjects, making diabetics more susceptible to infections, according to a study published in Current Diabetes Review. Damage to the circulatory system slows healing. Sarah Sato, NP, CDE for the Alpine Center for Diabetes, Endocrinology, and Metabolism, explains further, some diabetes patients have damage to the circulatory system, which slows the healing effects of the blood from getting to and from those areas. Sato also said that some diabetics might experience delayed healing. When someone with diabetes is fighting off an infection, for example, it leaves the body vulnerable. Sometimes, she says, if the body is experiencing inflammation related to uncontrolled high blood sugar, then the inflammatory response of the body can slow the immune response to new threats. To make matters a little less complicated, though, there probably isn't too much of a difference in how the virus plays out in people with type 1 versus type 2 diabetics, according DER. Robert Gabbay, Chief Medical Officer, Joslin Diabetes Center in Boston, the global leader in diabetes research, care and education. While diabetics and other chronically ill people or their families may feel especially overwhelmed right now, don't worry, you're not alone, taking action can help. How to stay safe from coronavirus if you have diabetes. Stock up on a few weeks' worth of medical supplies and insulin. DER. Gabbay recommends stocking up on medical and food supplies. This might include extra bottled water, which is necessary in the case of increased blood sugar levels, rubbing alcohol, ketone strips, glucagon, and foods like jello and hard candies for when you're too ill to eat but need a bit of sugar. You'll also want to make sure you have enough medication available to manage your diabetes. Make a virtual medical plan in case you're quarantined. If you're using insulin, you'll need at least a week ahead supply, and you'll need to know how to adjust your insulin doses to maintain healthy blood sugar levels. If you're quarantining yourself or planning to, it's a smart decision to get your refills arranged with your local pharmacy and to be in regular communication with your healthcare provider. Even better, check with your doctor to see if they can provide virtual visits or other digital check-ins, as well. While all of this sounds pretty apocalyptic, Sato offers a friendly warning: it doesn't make sense to stockpile so much medication that it ends up going bad. A few extra weeks ought to be enough, and most diabetics try to keep the supplies filled like this anyway. Practice social distancing. You'll want to make sure that you're practicing social distancing at this time, only leaving the house when it's absolutely necessary, and leaving about 6 feet between you and strangers. The virus spreads fairly easily through infected surfaces, think doorknobs and faucets, as well as from droplets from other infected people coughing and sneezing. What if, after preparing your household, practicing social distancing, and quarantining yourself, you think you may have contracted the COVID-19? Be sure to follow the CDC guidelines, call your doctor, stay home, limit contact with people and animals, and wash your hands well and often. Just make sure to dry them carefully so there's no residue on your fingers before you prick your finger when checking blood glucose. The CDC suggests washing them with soap and water for a full 20 seconds. Your self-care during sickness should mimic what you've done in cases of the cold or a flu, Sato says. Get plenty of rest, reach for your H20 all day, eat well, and continue to monitor your blood sugar levels, which can be more unpredictable when ill. Have an emergency contact on speed dial. In general, it's a good idea to have a friend, family member, or trusted neighbor on a proverbial speed dial so that they can bring you groceries or call your doctor in case you're unwell. They should be someone who understands your history of diabetes and can help you if you need it. Whether we're dealing with COVID-19 or not, it's smart to be prepared. Our best product, Diabetes Freedom. This system helps thousands of men and women who follow it improve the blood sugar levels. Of course, results vary according to the condition you're in, the medication you take, and the length of time you've had high blood sugar. Some people will get better results than others, but nearly everyone who follows the system will experience an improvement in blood sugar levels. The entire Diabetes Freedom will be available as a digital product that you can download or watch and read online from the members area. Remember, I recommend you use the Diabetes Freedom to naturally balance your blood sugar, and then decide with your doctor when to go off your medication. Diabetes Freedom is based on research at University of Utah, Texas University, Newcastle University in England, Harvard Medical School, and 14 other studies from reputable institutions. Thanks for your so much interest, and we hope you like our video and our product, and hopefully you would subscribe our channel. Thanks a lot. Goodbye.